Hey guys, today we're going to talk a little about colds and we're going to show you 10 ways to get rid of a cold fast. A cold is a common viral infection that affects the upper respiratory tract, mainly the nose and throat. It is caused by different types of viruses, with rhinovirus being the most common. Symptoms of a cold include runny nose, nasal congestion, sneezing, sore throat, cough, mild headache, mild fatigue, low-grade fever, sometimes, especially in children. When a cold virus enters the body, it sets off a series of events to replicate and spread, leading to the symptoms we associate with the illness. The cold virus usually enters the body through the nose, mouth, or eyes. It can be spread by airborne droplets, such as when someone sneezes or coughs, or by touching contaminated surfaces followed by touching the face. Once inside the body, the cold virus attaches itself to cells lining the upper respiratory tract, such as the nose and throat. It enters these cells and begins to replicate, using cellular machinery to create more of itself. The body detects the presence of the virus as a threat and activates the immune system. Infected cells release chemical signals called cytokines, which alert the immune system to the presence of an invader. The immune response causes inflammation in the airways, which leads to an outbreak and the production of mucus. This results in symptoms such as a runny nose, nasal congestion, and sore throat. Mucus also helps trap and remove viral particles. As the virus replicates, it can spread to other areas of the upper airways, making symptoms worse. Coughing and sneezing are the body's response to try to expel the virus. Eventually, the immune system mounts a more robust response, producing antibodies that attack and neutralize the virus. Fever, although not common with all colds, can occur as part of the immune response. As the body clears the virus, symptoms begin to lessen. Full recovery usually occurs in about a week to 10 days, although the cough may persist longer as the airways heal. During the process, the body also develops some immunity to the specific virus that infected the cold, although this does not prevent future infections with other types of cold viruses. Catching a cold usually occurs through three main modes of transmission. 1. Direct contact hand touch. When you touch a surface contaminated with the cold virus, such as doorknobs, telephones or keyboards, and then touch your face, especially your nose, mouth or eyes, the virus can enter your body. Hand opening, direct contact with an infected person, such as shaking hands, can transfer the virus to your hands, which can then carry it into your respiratory system. 2. Droplet transmission, sneezing and coughing. When an infected person sneezes or coughs, small droplets containing the virus are released into the air. If you inhale these droplets or they come into contact with your eyes, nose or mouth, you can catch a cold. Close talking. Talking to someone in close proximity can also result in the inhalation of infected droplets. 3. Contact with contaminated surfaces, fomites. The cold virus can survive on surfaces for a period of time. If you touch a contaminated surface and then touch your face, there is a chance of becoming infected. Common surfaces include handrails, keyboards, cell phones, tables, and toys. Some risk factors for catching a cold include closed environments. Being in crowded, enclosed spaces, such as schools, offices, and public transportation, increases the risk of catching a cold because it facilitates transmission. Weakened immune system. People with a weaker immune system, due to stress, lack of sleep, or other health conditions, are more susceptible to the virus. Climate change. Although cold weather does not cause a cold, sudden changes in temperature and dry air can weaken the body's natural defenses, making it easier for the virus to take hold. To reduce the risk of catching a cold, it is important to wash your hands regularly, avoid touching your face, and keep your distance from people who are visibly sick. While there is no immediate cure for a cold, there are a few things you can do to help ease symptoms and speed up your recovery. Here are 10 tips for getting rid of a cold faster. 1. Get adequate rest. Get plenty of rest, Rest allows your body to focus its energy on fighting the infection. Get enough sleep and avoid strenuous exercise. 2. Stay hydrated. Drink plenty of fluids. Stay well hydrated by drinking water, warm teas, such as ginger or chamomile tea, and soups. Fluids help thin mucus, making it easier to clear and relieving nasal congestion. 3. Relieve symptoms. Pain relievers and antipyretics, over-the-counter medications, such as acetaminophen or ibuprofen, can help reduce fever, relieve headaches, and relieve muscle aches. Decongestants, nasal decongestants, such as saline nasal spray or oral medications, can relieve nasal congestion. However, nasal sprays should be limited to a few days to avoid the rebound effect. Lozenges and gargles. Throat lozenges and gargling with warm salt water can help relieve a sore throat. 4. Humidification. Use a humidifier. Keeping the air moist helps relieve nasal congestion and irritation. If you don't have a humidifier, inhaling steam from a bowl of hot water can also help. 5. Diet. Eat well. Nutrient-rich foods like fruits and vegetables, especially those rich in vitamin C, oranges, kiwis, strawberries, and zinc, meats, nuts, seeds, can support your immune system. 6. Home remedies. Honey and lemon. A warm tea with honey and lemon can soothe your throat and provide relief from a cough. Chicken soup. Chicken soup is not only hydrating, but it can also have a mild anti-inflammatory effect and help relieve cold symptoms. 7. Avoid irritants. Stay away from smoke and pollutants. Cigarette smoke, dust, and other irritants can worsen symptoms and prolong recovery. 8. Boost your immunity. Supplements. Although the evidence is mixed, some supplements, such as vitamin C, zinc, and echinacea, are often used to try to reduce the duration of symptoms. Consult a healthcare professional before using supplements. 9. Keep your nasal passages clear. Rinse your nose with saline solution. Rinsing your nasal passages with saline solution can help clear mucus and relieve congestion. 10. See a doctor. Seek medical advice. If symptoms persist for more than 10 days, become severe, or if complications such as chest pain or difficulty breathing develop, it is important to see a doctor. While these measures may help relieve symptoms, your body still needs time to fight off the virus, and full recovery may take a few days. That's it guys. If you liked the video, follow our channel, like our video and share it. See you next time.